Hi, everyone. Welcome. My name is Ariel, and I'm so happy to be here with you all today. Thank you for being here. This is my very first time presenting at Diabetes Matters, so I'm super excited to be here with you. If at any point you have any questions during our time together, please just let me know, raise your hand. Um, I'm here to best serve you, so any questions you may have, just feel free to ask. Hello, welcome. Welcome in. So today we are going to be talking about thriving with diabetes, small changes, big impact. Our objective for today is I would like all of us at the end of this session to feel informed, capable, and empowered to move forward with helping you better understand diabetes, to feel more confident managing it, and to leave with practical tools that you can start using today. So just a little bit about myself. My name is Ariel. I am the inpatient diabetes nurse educator here at Washington Health. That's my role up there. I am also an adult gerontology clinical nurse specialist. So I'm bringing previous experience and education to my role here. And I have a deep passion for service, teaching, and education. So I'm very happy to be here with all of you today. So today's theme, as mentioned, is thriving with diabetes, small changes, big impact. Small, consistent actions can positively impact our health and outcomes over time. We're just going to start off by doing a little baseline introduction of what is diabetes. So my question for engagement today is, when you hear the word diabetes, what comes to mind?
Restrictions.
Sugar, restrictions, anything else?
Life change.
Life change, yes, very true. Okay, thank you so much. So I'm just going to talk a little bit about what is diabetes. I just want to note that diabetes is not a personal failure. A lot of times I have conversations with my patients who actually feel quite a bit of shame around diabetes, and that's not something that we ever want our patients to feel. It's a medical condition that's influenced by various factors that include genetics, lifestyle, environment, stress, and aging. So our mission here is to provide awareness, support, and guidance along the diabetes clinical pathway for our patients in our community. So diabetes is a condition where the body does not make enough insulin or is unable to use it properly. Insulin is the hormone that is naturally produced by our pancreas, and it regulates our blood sugar. It acts like a key to let sugar, also known as glucose, from the food we eat into our body cells so that we can use it for fuel and for energy. In diabetes, the lock and key system is compromised, which eventually leads to elevated sugar in the blood, also known as hyperglycemia.
Excuse me, can you explain why it's compromised?
Yes, so it's compromised because what's happening is the insulin that's being produced by the pancreas is not being receptive to the cells. So usually it's compromised because of insulin resistance.
Right, but why? I'm kind of digging down deeper.
Yeah,
because I had never heard why before. I heard it from another source. So I just kind of want to know if we're all talking the same thing.
Sure. Do you have any insight that you want to share, or you're just from the source that you heard prior?
I have heard that from numerous sources that it's because the fat in the cells prevent the insulin key from opening the lock to let the sugar in, but want the glucose in. But once you get the fat out of cells, the insulin key works and the sugar comes in.
Okay.
Now, I've heard that from numerous sources.
Okay.
But I've never heard that from a diabetic nurse dietitian. And I just want to know
Yeah.
If that's your understanding or what you think about that approach.
Well, to be honest, I am not familiar with the fat and that affecting the insulin, but it's definitely something I would want to look into. But it sounds like your sources are explaining more of the pathophysiology behind it, which I don't know unless Nancy has something to add to that.
I don't know, I'm sure that may play a part of it, I would think, but I would say too that people fall aside, like people who have very low BMIs also have diabetes. So I don't think it's the only reason that there's an resistance.
But for the key not working, there's other reasons for the key not working.
I'm not sure exactly, I just know that the insulin stores run low over time. Once you go diagnosed with diabetes, but I don't know exactly why either. But
Okay.
probably other people.
Yeah.
I've heard other stories too that it's a protein. I've heard it's also parasitics that could be doing it. You know,
Okay.
I mean,
Yeah.
because they haven't really found the cure. So maybe it's different things for different people. I know it was in my family.
Yes.
Yeah, so I'm dealing with genetics and aging now.
Okay.
Yeah,
Okay.
I mean, that's what I feel. But then I notice when I eat certain things, it goes up, and when I don't eat certain things, it stays okay. I wish to help they could find a cure, but everybody's got some saying of a cure, but.
No, I've never heard of it being a cure. But
Yeah.
in remission,
Yeah,
more like in remission.
yeah.
Well, maybe we'll save more of the questions for the end though, because we are recording it for the future.
Oh, sorry.
That's okay. That's okay. But that's a great question. Definitely going to look into that more because I find that very fascinating. So to move on to talk about diabetes type 1, just a quick overview. This is when the body's immune system mistakenly attacks the pancreas. So this is what is considered an autoimmune disease. The pancreas at this point is no longer able to produce its own insulin, and individuals are treated with daily insulin. External insulin. In type 2 diabetes, the body cells become resistant to insulin and don't respond to the key like it should. So this is what we term insulin resistance. Over time, the pancreas does not make enough insulin to overcome this resistance. And type 2 diabetes is managed with lifestyle changes and medication. So living well with diabetes, our goal is to help create and optimize a comprehensive and individualized plan of care to decrease the risk of complications and improve health outcomes for all individuals living with diabetes. Our goal is to have a practical and empowered path forward. We really want to support self-efficacy of the individual, and goals are to create sustainable consistency, meaningful progress, and confidence growth in self-care. So we're going to discuss the diabetes lifestyle toolbox. Everyone's toolbox is unique because we're all unique individuals, but there are core categories we all benefit from. So moving down the line, we're going to review about nutrition, nutrition, movement, medication, stress management, follow-up care, and education. So for nutrition, some areas that we're going to want to be looking into in our daily practice is carbohydrate counting, protein. Are we getting enough protein in the diet? Fiber? Are we following our portion size awareness, having balanced meals, and adequate hydration? We want to try to avoid using the terminology of good foods versus bad foods. Really, I think sometimes that can make it a bit more challenging when we're looking at our dietary choices. Movement. So movement is medicine. We always recommend that you're physically active to your physical capability, but this looks like walking, running, resistance training, stretching, dancing, aerobics, gardening, and housework. So one of my questions is, what is your favorite way to move your body? Mine personally is walking and dancing. Does anyone want to share?
No control.
One of the questions I would, as I used to dance a lot, but
Yeah.
I've developed joint arthritis.
Mm,
And it's kind of sad because when I move a lot, then I hurt a lot.
yeah.
So what I've done was tone down moving,
Okay.
doing more Tai Chi things, but I
Yeah.
don't feel I'm getting the workout that I used to get.
More of like
So it's
the,
like become a catch-22 in some ways.
yeah. And that would make, you don't want to be feeling any physical pain from your movement. So in dancing, I know it can sometimes have high impact, especially if there's kind of like more jumping or
And
leaping.
also I'm more tired. I do a
Mm,
task, I have to rest,
yeah.
where I used to be able to be multitask. But I'm sure that has to do with aging as well. But the diabetes, I'm sure doesn't help either. Makes you feel
Yes.
tired.
Yes, yes. And very important to balance your rest and activity periods, which it sounds like you're doing. Yeah.
But don't you also do a lot of gardening too?
Yes, I do.
Yeah.
Gardening's not the same as dancing, because when I used to dance, um, I was a dancer, so I did floor work, ballet, modern jazz,
Wow.
stretch my body,
Yes.
so it's not the same kind of dancing I could do now, or stretching out that I can do now.
Mhm.
Yes, I did do gardening. And after gardening, I'm exhausted. I just watered my plants just before I came here.
Mhm.
And I used to be able to do the front and the back all in one round.
Mhm.
And now I can only do the front, then I have to take a break for an hour or two and then go do the back. Which is annoying because I like to do things. You see, I had this appointment and I didn't want to be late.
Well, I'm glad that you weren't late. So and it's important. Your plants, you get your rest and then your plants get the best of you again. So,
You just have to balance, like gentleman said, it's a life change.
yes, yes, definitely. Okay, well, thank you for sharing. So for medications, the goal here is to ideally practice medication adherence. And ways that we can do this is by setting reminders to take our medications. Alarms are my, way to remind myself to take what I need to take. If we have pill organizers to make sure we're putting everything correctly in the right day. Following a routine and schedule that works for you based on your provider's prescription. And closely monitoring any side effects and symptoms. I know a lot of medications can often cause uncomfortable side effects, and symptoms from that. And so you want to make sure or ensure you're sharing those symptoms and side effects with your provider so that they can best guide you on how to move forward and how to best manage those symptoms. Stress management. So stress is a big, big impact on our blood sugars, especially if we're under chronic stress for long periods of time. Basically, the main key point of this slide is to practice self-care, the self-care that works best for you, that would be healthy and good for your well-being. A couple of examples here are meditation, mindfulness, journaling practices, deep breathing, getting out in nature, light to moderate exercise per your tolerance, keeping your social connections and your relationships close. That's very, very important. Having an aligned sleep routine. So I say that because our sleep is very important to keeping our stress levels well managed and our overall health well managed. So keeping it for what works best for you, because not everybody has the same type of sleep schedule. And self-care again. So the other important key component is follow-up care. We recommend that you have your routine follow-ups with your clinicians. These include your PCP, primary care doctor, your endocrinologist, dietitian, diabetes nurse educator. These Clinicians can help you with creating individualized support, patient-centered care, guidance, and also accountability, which is very important in management of our health, management of life, everything. So this slide is focused on reducing risks. This is where we want to incorporate preventative care to reduce the risk of long-term complications of diabetes. You've likely reviewed this with your provider at some point, but the goal is to have annual eye exams to ensure your eye health is being monitored, and to also monitor your cholesterol levels annually. You want to have a routine dental exam once every 6 months. And your regular A1C tests are usually drawn anywhere from 3 to 6 months. This is based on what your provider would recommend for you. Managing your ABCs, A stands for A1C, B stands for blood pressure, and C stands for cholesterol. Our goal is to keep our A1C below 7% and our blood pressure below 130/80. Cholesterol, the HDL should be greater than 40 for men and greater than 50 for women. LDL goal is to be below 100. And then we also have foot care here. It's very important to assess our feet daily, ensure we aren't acquiring any sores or open wounds. Even if there's a spot that looks compromised but isn't open, you want to keep close eye on that. Try to wear shoes that support your feet, protect your feet, and keep your feet nice and clean. Try to avoid any type of shoes or socks that may cause too much friction. Oh, another thing, we never want to clip any hangnail or any toenail that might look compromised on our feet. We want to try to send that to the podiatrist to take care of, not do it ourselves or go to the salon. Sometimes that can cause other issues that we want to try to avoid. And our next pillar is education. So our goal is to stay informed with the latest information on diabetes management, studies, and clinical advancements. There are very, very many educational resources that are online that can be found through books and journals, journal articles. The American Diabetes Association also has a lot of great resources on there. Coming to our outpatient diabetes education center, community support groups like this. So Diabetes Matters is a great example of that. And even participating and engaging in educational workshops. So knowledge is power. Awareness supports our self-empowerment and our ability to effectively manage and care for diabetes and our overall health. So here we practice a culture of progress, not perfection. We don't, instead of saying perfect days, we like to focus on having better choices, consistency, and learning. Perfection is not the goal. It can make us feel like we're not meeting certain standards or certain goals. We just want to feel like we're improving a little bit more every day. So my reflection question to you is, what is one thing that you feel you are doing really well right now? I know you are.
Exercise.
Perfect. Okay. Okay.
I think I could do more better.
Yeah. And we all
Some
can.
potato chips.
We can always, there's always room for improvement, I say.
Yeah.
So that's totally valid.
Keep it up on a long-term basis. You're gonna cheat every once in a while.
Yeah. Yeah. And that's okay. No, it happens. Okay. Thank you for sharing. So our action plan. So as mentioned, knowledge is power, but action is power in motion. So I'm not sure if you all have paper or if you want to use your pen, but I do have this reflection exercise of completing the following sentence of this week I will, and then you can fill in the rest. But some examples here are walk after a meal for 3 days, drink more water, so consuming less soda or juice if that is a part of your diet, taking medications consistently, adding vegetables to one meal each day, and checking blood sugar regularly. So this are just some examples of ways that we can continue to build daily on our progress. And don't forget to document your wins. Keeping a journal or anything of the sort would be very helpful in that regard. Sometimes we overlook our progress, and these little wins are actually, they turn into the big wins, and they help us to see that change is possible. So our wins compound over time. There is real power in looking at the evidence of our previous successes. So don't underestimate how far you have come and how far you will continue to go. I have another reflection question here. We can go through it if you'd like, or we can move forward. But what is one healthy habit you've successfully added to your life before today?
Watching what we eat.
Yeah, that's great. Being mindful of your diet and what you're consuming. Mm-hmm.
Also, I'm trying to stay within the time frame because they said controlling the sugar is also keeping a schedule of when you eat.
Mm-hmm. Yes, exactly. So being mindful of when you're eating, how much you're eating, what you're eating, keeping a journal. Mm-hmm. Yeah.
I have to work on that at the time. Sometimes I eat late and I shouldn't.
Mm-hmm.
But breakfast and lunch I have pretty much on time. But dinner, that's what comes. Yeah, I'll be eating dinner now.
Okay.
Yeah.
Okay.
So that throws it off.
Yes. And I know that's very schedule based. So for example, some individuals, their breakfast might always be thrown off, or lunch or dinner, or sometimes all three. So I'm glad that you're getting your breakfast and lunch on time, and dinner, in the evenings, there's always a lot of activities going on sometimes. So, but yes, keeping a log will help with that. Okay, thank you. So living well with diabetes, as mentioned, diabetes is not managed through perfection. It's managed through our awareness, consistency, and small choices repeated over time. Every positive step that we take matters, and it builds your momentum from one day to the next. There is power in your progress, and your health journey is built one choice at a time. Thank you. That is primarily all I have for our slides. Please come see us at our Washington Health Outpatient Diabetes Center for continued education and support, community, and accountability. I really appreciate being here. As mentioned, this is my first time, so I look forward to receiving any feedback that you may have, any suggestions, any topics you'd like to review for next time. As mentioned, I'm a culture of progress over perfection, just trying to be better every day. So thank you so much for being here.